and it's sort of, I better not move around because I'm disappearing into it. Just see if I can try it.
Buddy, how's it been? How's everyone's week? Well, day. Everything good?
Yeah, good. All right for now.
Okay. Nice to see you, Gary. Okay, what we're going to do is quick fire, 30 seconds, quick 30-second pitch. Tell us who you are, what you do. And let's start with Wendy.
Great. I was like, oh my God, I've got to say something. Evening, everybody. My name's Wendy and my company is Gold Standard Pest Solutions. We're a Kent-based pest control company. So we do all the usual stuff. So if you're worried about wasps or rattled about rats, then we're your people to help. We also put in place all the preventative measures that you might expect, blocking holes, spiking roofs, that kind of thing. Also part of our business is the sanitising and virucidal fogging treatments. So if you have a business site that needs cleaning up before reopening after lockdown, we can carry out those treatments for you.
I don't think we've had a pest controller before, have we? I don't think we have. Today's presentation will be great. You really need to connect with my compliance people. They'll be great for you, seriously.
Okay.
Gary, how are you doing? First time you've been to this event.
Yes, it is. And thank you for inviting me.
Yes. You too. Tell us.
Okay, so my name's Gary. I'm a work-based training provider. Predominantly, my expertise is in first aid. However, my company does provide food safety, fire safety, manual handling, and a whole heap of different other sort of subjects as well, which includes mental health first aid as well. I thought I'd give a little Monday first aid tip for anybody. Some of you probably heard this one when he was on the meeting on Friday. But it's a very simple thing. With the coronavirus, obviously, it's not very safe to get very close to people if you want to assess people, if you suspect that they might need some help. So a quick test, rather than sort of trying to put your hands on necks, trying to find pulse, you just quickly pinch your finger. If you pinch your finger, you'll lose the colour in the tip of your finger. And then if you let go of your finger, the colour will return back to the tip of your finger. That's a clear sign to show you that your heart is still pumping. If your heart was not pumping, it would not pump blood up the tip of your finger. And therefore, you would be dead. Okay, so if you've got a casualty, if it's not happening, then you know what to do now.
I've just seen Chandra shot, but because he's a red Indian, it makes no difference whatsoever.
Like I say, mine doesn't go white. It just stays red.
I suppose it depends on how hard you pinch.
I can safely say I think you're still alive.
Well done.
Chandra, I'm guessing you do workwear.
How did you guess that? So Chandra Sharma from Tangent Workwear. We help the hospitality industry, and I'm really looking forward to the 4th of July. And hopefully there's some good news tomorrow in regards to the 1 meter rule. That's what hospitality needs. We can help you with your brand to make sure you project the right image when you open back up. That's Chandra Sharma from Tangent Workwear.
Brilliant, thank you. Guy, how are you doing? Nice to see you again. Can't hear you, mate. Okay, we'll come back to you, Guy. Yogesh Bey. Can't hear you either.
Hello. Hello.
Hello, Yogesh.
Sasan, Chartered Accountants. Who do we help? So if you're a restaurant owner and if you've been trading for a while and if your profits are not there, when you set up the business, you thought it's going to be all hunky-dory, you're going to hit all the profits, but it's a sizable turnover, but the profits are not there, or you are overwhelmed with paperwork because of all the compliance requirements from HMN and Customs and Companies House. I have small businesses to systemize and organize your office so that you got all your numbers in one place, so that you can proactively manage your business, so that you can go towards your profit targets every year by proactively managing your business. So you can leave all the numbers to us, the compliance right to us, so you guys can focus on the business. That's us, Sasan & Co. Chartered Accountants.
Thank you very much. Mr. Gupta.
Hi. Hi, this is Surendra. I'm Surendra Gupta. I am in fast food business for past 20 years. Sold my business very recently and set up a consultancy business where I help new and existing franchisees set up their business in a stress-free environment.
Brilliant. Thank you very much. Guy, can we hear you now? No, we'll come back to you. Mark, welcome back.
Hi, how you doing, guys? Yeah, great to be here again as always. And I run a marketing agency. Sorry that I'm not on video at the moment, but I'm out in the back garden. There's a bit of background noise. Run a marketing agency. We predominantly work with the hospitality sector, doing strategy planning and implementation across all different digital channels. And but we don't work exclusively with hospitality. We can work with any other business. And yeah, apologies for noise. I'll go mute.
Brilliant, thank you. Rena, welcome back. Oh, panicking.
Hi, sorry. Multitasking at the moment, trying to feed Zaya and yeah, everything. Hi, I'm Rena, Henel's boss. So I own Red Cup Cafe, Cafe in Northwest London. Yeah, these webinars have been really fantastic, a fountain of knowledge from all the industry experts, and you know, the hosts have been brilliant. I have to say that because Henel's on it. But yeah, honestly, really, and I've been promoting it everywhere and just telling people about how fantastic they are. So I've taken on a lot, and I've literally learned every single week. I've learned something and taken it on board, hopefully just to better my business. So thanks, looking forward to today.
You're welcome, thank you very much. Michael, are you just observing today, or will we hear from you?
Hi.
He's there. Come on, Michael, tell us who you are.
Michael, and I'm a chef in a theater. I work in a theater, and I'm a chef in a restaurant in a theater. So that's my whole story. So I'm here to learn. So I think there's only 2 times that I haven't been here. But I'm always off because I'm like cooking and things like that. But I'm listening and taking down notes, if you don't mind.
Are you going to show us a recipe later? I can see you're all prepared for it.
Yeah, I'm just making some pasta sauce.
Come make me dinner anytime.
Right. Where is she? Guy?
Your time lucky, maybe?
You got out?
Blimey. Right. Guy Porteous, Sterling Stock Auditors. I'm a stock taker and consultant to hospitality businesses, helping them use their stock effectively and increase their profits.
Thank you very much. Lydia, what do you do?
I do marketing. You love asking me that. So, hi everyone, I'm Lydia, and my business is called I Do Marketing. I'm a marketing consultant, so I write marketing plans and strategies for businesses, and also help them implement those across social media, email, advertising, and also offline. So yeah, I'm part of the Build Back Better team, and yeah, they've been brilliant sessions. The level of knowledge is really high, so it's great, very beneficial.
Thank you. Natasha.
Hi everyone, I'm Natasha, owner of Blue Feather Designs. I'm a restaurant designer primarily, and have been helping with the Build Back Better team as well, trying to make sure the hospitality industry comes back bigger and better than ever before.
Brilliant, thank you very much. I think we've covered everyone. Henel, do you want to?
So yeah, as you've heard, I'm the kitchen porter for Rena, Red Cup Cafe. I'm also becoming a strong activist for the small business in the hospitality, trying to put my voice across and make sure we're all looked after now. So actively tweeting now under my own name, not the company name, because she's told me not to use my personal views there. But yeah, we want to help everybody. All these sessions, I've spent every week some time with everybody after these sessions and got some really useful information. So I can't tell you how immense all of this information is. It's priceless as far as I'm concerned. Today I'm looking forward to, because hygiene has a heart for me. So yeah, that's me.
Good. Angeline, let's give you a go, but you've got the guest spot today, but let's give us a little taster of who you are, what you do, and that kind of thing.
Yeah, thank you. Well, I'm very grateful to be here today as your guest to share some of the insights that we've been having over the last couple of months. I'm a chartered environmental health practitioner. So I've been working in local government, enforcing the law, as well as working for much loved high street brands, helping them primarily when there's crises. So that would be serious accidents, doing accident investigations, doing defence work for prosecutions, and also doing serious food poisoning outbreaks. And mainly a lot of my work is with boards of companies, helping them shift culture around food safety, health and safety. Really getting high levels of team engagement so that we can actually change behaviours and create the right cultures. And within that, over the years, we sort of recognised that working as a freelancer myself, that there was a gap for freelancers to work direct with businesses and help those freelancers connect with businesses so that the businesses could access the top level safety consultants that they were accessing through consultancies and paying, you know, a very high premium for essentially what was the freelancers rate. So that's why we developed My Compliance People, and it's a marketplace where you can find every kind of safety expert, whether it's a fire risk assessor, a food safety expert will help you with labelling or trading standards, or somebody that help you with accidents, all sorts of experts on there with their pricing, and you can buy their services direct, put it in your shopping bag, and job done. And we also provide loads of free resources, keeping everyone up to date with curated content for free. I think Henel, we had a chat last week, and Henel has signed up for free and got access to our COVID template risk assessment and COVID workbook, which should help him put the right policies in place so that he doesn't have to spend all that time and energy reinventing the wheel, that it's all done by experts. So that's kind of the help that we're looking to offer. So,
I can't tell you how invaluable this information is, honestly. As an operator, God, this is like the gold standard that you're getting from Angeline's company. It's invaluable, so thank you for that, Angeline.
You're welcome.
Let's catch as members too. Guys, I think everybody, I'd encourage them. It's Wendy, Chandra, Gary, you know, in the industry, you're in the hospitality trade, you really need to speak to Angelina and see what she's all about. It's awesome. Definitely.
Yeah, it's really interesting, you know, just interesting what you all do. And obviously there's loads of synergies as well. We're all working in the hospitality industry, all with a similar client. So there's definitely a synergy to help each other. So I'm really up for, you know, how we can join together and promote each other and see what each other does. And there's lots of opportunity to share, certainly with our business clients, you know, as well. So.
Brilliant. Okay, well, look, let's crack on. I think I've covered everyone. Right, if I can hand you over to the main host. You know, I've already forgotten, but I'm sure it's Lydia.
It's me. So good evening, everyone, and welcome to our 6th live webinar brought to you by the Build Back Better team, comprising of myself, Piyush, Henel and Natasha. We hold these sessions every Monday at 6 p.m. and they are completely free to attend. All we ask is that you register your place beforehand. It is worth noting, however, that the Zoom details you use today will remain the same for future sessions, so keep them safe. The sessions are limited to 45 minutes as we appreciate everyone is under time pressure amongst everything else. Please note we may be taking photographs at the event, which could be shared on social media. Please let me know if you don't want to be or wish to have your picture taken or shared. If you could please stay on mute for the duration of the talk. Please feel free to post any questions in the chat box and there'll be a Q&A session at the end. And today, Natasha will be looking after the chat box and will monitor any questions for the guest speaker. And our guest speaker is Angeline. who is a chartered environmental health practitioner who we just heard from, and she's got a proven track record in transforming risk and compliance cultures of much loved high street brands. She's supported TGI Fridays to be the first restaurant brand to be hygiene rated 5 across their portfolio, and made a significant impact on the reducing insurance premiums through her work on health and safety with the brand. Angeline is a co-founder at My Compliance People, the UK's first UK's first safety and compliance marketplace, helping businesses discover and hire top UK safety freelancers. She blends her entrepreneurial activities with consultancy work, as well as teaching, coaching, and mentoring tomorrow's safety leaders and environmental health practitioners, using insider strategies from her vast experience in the field. We're so pleased to have Angeline with us today, and as the current climate in navigating everything we need to know around health and safety is so difficult. So Angeline will be helping us with some clear guidance and everything we should be thinking about, and I'll hand over to you.
Super, thank you very much. I thought I would just flow through a very short presentation just to give some context and sort of support with some of the questions that you might have. So if I just share my screen. Okay, so everyone can see my screen? Am I getting nods? Yeah, I just have to move everybody over here. So the COVID-19 guidance, obviously things are ever changing. And like we say, we're waiting tomorrow for some updated news on what the guidance is going to share around, particularly around this rule of physical distancing. I'm using physical distancing because Henel and I had a good old discussion last week about social versus physical. So he'll be very pleased that I've put physical distancing in my presentation. So, and actually, I think this is really going to be the pivotal part of the guidance tomorrow as to whether we actually get prescriptive or not prescriptive. The industry, in terms of the expert circles that I've been speaking in, are clear that at the moment it's not going to be prescriptive. So we might well see a very flexible standard tomorrow, which encourages people to minimize to maximize the distance between people, but maybe not actually suggesting an actual meterage in the guidance. So it's going to be an interesting day. In terms of the actual guidance, we all know that the businesses are very, very different, and this is the reason again why the guidance is coming down to there isn't one size that fits all, and you have to make your individual risk assessment. And I think, you know, what I would sort of suggest to everybody is that everybody knows how to do risk assessment. We've been doing risk assessment for, you know, activities of you know, going up ladders and working with hot equipment and you know, working in on roofs and all sorts of other areas of health and safety. This is no different. It just demands an understanding of what potentially could harm your employees, what could potentially harm your customers and other people like visitors and contractors coming to your business. And as long as you keep that in your kind of mind's eye, then you just need to put in what we call suitable and sufficient controls. And I'll pop onto that in a minute. So the guidelines, as we've seen so far, are sort of permissive. So they're very flexible and allowing for different approaches. So I think, as I say, we'll wait for tomorrow to get some clearer guidance. There aren't any prescriptive controls in there currently in the drafts. So you can't really measure against a set standard. So it's all coming down to what's reasonable, what's practicable, what's suitable, what's sufficient in that particular situation, which is great because, you know, at the end of the day also, it's about being pragmatic and it's about consumer confidence and making sure that you're thinking about how customers feel about the controls that you've put in place. You know, some of us talk about the theatre of, you know, it's the sense. How do you create that atmosphere that you have this under control within your four walls. So in terms of high contact areas, one of the things, you know, that lots of hospitality businesses have been thinking about is, what do we do about menus, and what do we do about coming to the table, and what do we do about ordering? So these are some of the things that people are considering. You know, there are some clients that are looking at disposable menus, whether they laminate them so that they're actually cleanable with a sanitizer. Some people are doing mirroring. So I've seen some clients that are looking to use their TV screens to put menus up. We've got the apps as well, so booking online and at the table. And also, you know, pivoting your business for delivery and takeaway. That's also, you know, we've obviously seen a lot of that pre the July the 4th as an option to continue to stay open. In terms of the guidance and legal requirements, so the requirement is that all employers have to carry out a COVID-19 risk assessment. So you need to make sure that that's in place. If you have under 5 employees, you don't need to write it down. But if you've got over 5 employees, you do. And that the government are also saying that if you've got over 50 employees, then you do need to publish your risk assessment on your website. So the idea with this is about transparency. It's really about asking owners and operators to record what they're doing, write it down, and then share that with their customer base. And one of the things which is very, you know, that the government are also asking is that there is something called the COVID Secure poster. And that poster is downloadable from the government website and also our free resources section. And they're asking for that to be displayed front of house in your window, so that you can give confidence to customers that you have addressed all of the COVID secure things that you need to do. And I think, you know, this is something to think about in terms of the last thing you really want to do when you're reopening your doors is having conversations with customers about cleaning and about your controls. You want to be talking about, you know, the menu, and you want to be talking about delighting the guest, and you want to be making sure the experience is amazing. So if you can get all of these ducks in a line and get all of that sorted, then you can have the right conversations with customers. And I think in terms of, you know, is the business actually complying with its own risk assessment? You know, it's all very well to have it written down, but how do you make sure and monitor that that actually is being put into place? And this is where it kind of comes into, you know, your teams and making sure that teams really understand the reason why you have particular policies and processes in place, and that they're actually following it themselves. So things like hand washing, you know, really doing the proper hand washing, front of hands, back of hands, you know, thumbs, fingers, wrists, happy birthday 3 times, really making sure that all of these practices are really obvious and in some way overemphasized whilst you bed in this new way of working, because it's going to take time for this new norm to become the kind of the way that we work. You know, I don't know about you, but I know how difficult it is when you have a new team member coming into a business to help them to actually start to work in the way that you want them to work in. And that takes repetitive action time and time again, and it takes observation. So as leaders, we also need to make sure that we are leading by example. You know, one of our biggest problems in the past in safety is hospitals and doctors not washing hands and transmission of bacteria between patients, which is why we had things like the MRSA outbreaks. If doctors and nurses can't get it right, you know, you realize that actually something as basic as hand washing is actually quite a habit for people to practice and get right consistently. So have a watch out for that in terms of, you know, they take the paper towel and they turn the tap off with the paper towel, Or if you're really thinking about it, then you can put in touchless taps, which can help too. So physical distancing. In terms of the hospitality sector, we know that capacity numbers are really going to suffer at the 2 meters. In the public health circles, public health are really fighting for this maximum distance. And that 2 meters is quite, 2 meters is quite a lot. So if you're stood at a bar and, a customer comes in some business premises, the entrance doors and the distance between the door and the bar is less than 2 meters already before you've even just got in the door. So we'll have to wait and see, I think, tomorrow as to what happens. And there is a recognition, I think, generally in the hospitality business that the smaller businesses are going to struggle with this 2 meter rule. Other things to consider with the physical distancing, toilets. Do you need to take out, for example, a urinal between 3 urinals? Do you need to take out or look at your, if you've got a narrow corridors going into toilet areas so that, you're managing the flow? Look at your workflows and look at the business premises to see how you can actually manage the distancing. Bars, some people are a bit like Costa Coffees and Starbucks and anywhere that makes the drink at one end and then delivers it to the guest at the other end of the counter. That seemingly a lot of bars are looking at that option, so that they don't have that interaction with the guest just over the bar. Things like lifts and entrance and exits, making sure, if any of you have been out into retail recently, you'll notice I was in Next, for example, at the weekend, and they changed all their entrances and exits, but they have somebody on the door to make sure that people know about how to escape in the event of a fire. So you do need to think about those situations, emergency situations as well. We're all planning on the 2 meter, but obviously we don't know. Maximum capacity is important. Again, deciding on how many people you are able to have in your premises. And where you can't maintain, this is what the guidance says, which is why it says social distancing. Where social distancing cannot be maintained due to the venue design, then you need to put mitigation strategies should be put in place and implemented. And that really, the mitigation measures are increasing the frequency of hand washing and surface cleaning. With the surface cleaning, you really only need, it's ideal that you have a virucidal cleaner. In outbreaks of things like norovirus that I've dealt with in the past, it makes a huge difference to transmission if you up the levels of the chemical that will actually destroy norovirus for the contact time and do hourly cleaning. Like, we found clients that, in that situation where they don't do that and they get lots and lots of transmission and more outbreaks. In clients that have done that, they have limited the outbreak and it's basically disappeared. So although the government haven't said you should use a virucidal sanitizer, it would be my recommendation that you do. And that's to a British standard 14476. Most of the chemicals in our industry are designed to kill E. coli 157, and that is the British standard 1276. Which you should have for your 2-stage clean. So I would look at your chemicals and make sure on that. And also for the sanitizers, make sure that they are at least 60% minimum alcohol, rather than some of the other hand sanitizers, anti-bac sanitizers, which some of them aren't. They need to have that alcohol level in them to destroy this particular coronavirus. These three, they're saying, are kind of the most important: keeping the activity of time involved as short as possible, using screens or barriers. I've seen lots of examples of those, in between self-service tills, or taking self-service tills out. You know, think about those barriers. If you're, you know, people are coming into a takeaway or a shop, how can you put a simple barrier up to screen yourself from people coming in? Another option, if you've got teams of people, is using back-to-back or side-to-side working, or even considering that in your seating where you've got, you know, like the tables and chairs where you are back-to-back. You could also look at that in terms of being able to work your seating better. Reducing the number of people each person has contact with is quite difficult in hospitality because of the shift work. You know, that's unlikely to work particularly well, I think. And, you know, using groups of fixed partners, but you really need to assess whether you can safely go ahead with different activities. PPE, you know, there's lots of guidance and there's been lots of discussions I've been having with different people about what do we need to do. So really, the guidance is saying that you don't need to wear any additional PPE because PPE is a legal requirement, personal protective equipment. So there's no legal requirement that you must wear face masks other than on public transport and in hospitals at the moment. Those are two clear areas where you do. And there are actually regulations that have come into force to enforce that. So if you're working in a, you know, a train station, you've got a business in a train station or a hospital, that some of my clients do, then they will have to wear a face covering, which must cover the nose and the mouth. The face visor is not adequate. The face covering is there to protect others from you and your potential transmission, whereas the face visor is to prevent other people who are not wearing any protective face coverings, to protect you from transmission that they might be asymptomatic, for example. Lots of my clients are definitely providing face masks and recommending that staff wear them. So that's both the face coverings and the face visors. So make sure you've got ample supply of those. And lots of people are obviously concerned about supervision of customers as well, and how they actually enforce this distancing and how they support with capacities. So again, it's that team member training around how to manage conflict, really bringing in the empathy and compassion as leaders and owners of these businesses. And obviously consider, you know, crises, accidents and fires. And further, and sort of bringing on that sort of piece around sort of leadership. I think this is a really important point. We all talk about health and safety, and we all talk about, you know, making sure we've got the policies and the procedures and the cleaning, and we've got to remember the human element to all of this. You know, hospitality is a people business. This is a load of emotions that we want to connect with our guests. So really, in terms of, you know, performance and improving and increasing the performance and therefore sales of the businesses, we've got to get all this stuff right, but we've also got to train teams really well, and we've got to help them with these new behaviours to get this cultural shift. I'm really sort of starting to think about, you know, your own leadership styles, putting yourself in the shoes of the customer, so that empathetic part and the mindset that we all have, and also the boundaries for staff members to really help them to feel what's appropriate and what's right, and how they can actually kindly enforce the rules that, you know, you've set in place for your business, so that they know their yeses and that they know their nos as well. And we're really going to need, I think, in this hospitality, sort of the change is these softer skills are going to be needed to thrive, so that we really start to understand how it is in this new reality and this new way of interacting in a gentle and kind and caring way, as many of the hospitality businesses that I think that are the ones that are going to thrive were already doing this. So yeah, that's me with just some thoughts to share. So perhaps over back to you, Lydia, for the next part.
Thanks so much, Angeline. That was really interesting. There's quite a lot that I hadn't thought about as well in there. I've had probably more private questions than I've ever had in any webinar. So I'm assuming that's because people don't want us to know who's asked them. But I will ask them on their behalf, if that's okay. I'm just going to go through them all. So with the PPE, what can you do as an employee if your staff refuse to wear these things?
Yeah, it's an interesting question. Personally, and you'd have to check this with a lawyer, I'm not a lawyer, but I think you could terminate employment. If you're making a policy that they have to wear face coverings and face visors within your particular business and they're not complying with those policies and you've put them in place because of your risk assessment, that would be against legal requirements. Employees also have a duty of care towards other people, so I would put it under that. But you'd need to be clear that it was a requirement of working in your business under your risk assessment rather than a recommendation, because most of the clients I know are only recommending it unless there's a legal requirement in public transport areas or hospitals. So, yeah.
I guess in all of these, it's vital to have that open communication with your employees as well. Kind of explain what you're doing, why you're doing it.
Yeah, and I think mostly I've seen when I've been out and about, everybody I've seen working in retail, takeaway businesses are actually wearing face coverings or face visors. So.
It's obviously quite a popular question because we've got one on the flip side of that. What happens if your consumers don't comply? So if you've got customers coming in and they're not being safe, as you'd call it, or not really complying with your risk assessment protocols of social distancing, for example, what would you do then without upsetting anybody, I guess?
Yeah, I think this is where the conflict management comes in, and the real understanding and the practice with your team members to do some role playing with them so that they can actually viscerally feel how it is to navigate that as a challenge, because it is going to be challenging and there's potential for conflict to arise because it's a tense situation, and trying to understand what's happening with the individual customer and then clearly with the team member and referring it to the manager. In essence, if you've got a big business, the recommendation is to have somebody who's trained up to be the sort of coronavirus host, and they would be the one that be patrolling to support customers to make sure that they are adhering to the rules. But if like I've been into many places, and yeah, I mean, I think people are being pragmatic and sort of following the workflows of the arrows in the business. But if somebody just wants to whip and get a can of baked beans, the behaviour is that they don't go back all the way through the shop to pick up what they need to. So
I know obviously the UK hasn't caught on with the whole contact tracing thing just yet, but hopefully that will be something that will be coming into play. And then I've heard, because I think I told you I've done risk assessments for my school as a governor, and one of the things that is coming about is the whole PPI claims that was so abundant in recent years. It's going to be very similar with COVID related cases. If you've caught COVID, blah blah blah, come and give us a call, and there's like whatever it is with the no claim lawyers that they're doing. If and once the contact tracing comes into play, how are the hospitality operators liable if a customer is thought to have caught it from their environment or their premises?
Yeah,
I think a really difficult one to answer. Just
yeah,
now.
I think it's going to be incredibly difficult to prove because of the nature of viruses generally, and the fact that it's ubiquitous in the environment at the moment. It's everywhere. I mean, we just don't know. I mean, there's interesting discussions with clients to decide on a policy as to whether you allow your staff to have mobile phones so that they can have the track and trace app on their phone, because you have to be in contact with somebody for more than 15 minutes in order for that to sort of register. So I think that's really where you probably need to think as an operator is decide on what your policy is for mobile phone use with your staff, and whether you're going to change if previously your policy was that you don't allow it on the shop floor, and now it might be that you need to allow for them to have access to track and trace. That's as far as I would go with that.
Yeah, it's very interesting, and I think that's something that's going to evolve over time as well.
Yeah.
A really interesting question about those that are deaf or hard of hearing and the use of PPE. Have you got any thoughts on that?
In terms of,
because obviously they won't be able to communicate through lip reading, for example, or I guess sign language is the only way there.
Yeah, it might be. I haven't read the regs fully, but in the face covering, in the coronavirus face covering and on public transport areas, there are some exemptions as to people that can wear them. I don't know, for example, but maybe that there are exemptions for people that need to communicate in that way in order to be understood. But I imagine that's a case of you take it off when you needed to communicate and then put it back on.
Yeah. It all becomes pointless then, doesn't it? It's something again that I think will just happen with time. One question that I've had from my clients, and probably the biggest frustration in hospitality is around the kitchens and maintaining physical distancing within the kitchens. It's just not going to be possible, is it, in most cases? So what are your thoughts around that?
Well, I think it's very tricky. I think you just need to look at things like your menu and think about your different sections, and can you adapt so that you can start to maintain a distance which supports that the fact that you're not working side by side. And I think it's all going to boil down to being reasonable and practicable. If you haven't taken any measures whatsoever and you haven't even considered it to the extent where you've actually sat down, thought about it, and you've come up with what's a reasonable plan to put in place. I mean, if they say tomorrow it's definitely 2 meters, then yeah, clearly we've got a problem. But I think the guidance is also quite clear that where you can't adhere to the 2 meters, you can put in other mitigation measures. The fixed teams, for example, working in sort of like in work bubbles, if you like. Yeah,
the bubbles is how schools are doing it as well. Because you can't, in a primary school, you can't possibly have children staying 2 meters apart from each other. It's just not going to happen. So I imagine that's going to be something that most people will implement. If especially with the restaurant staff, I guess it's going to be the same staff in and out every day. So it makes sense to create a bubble in that way.
Yeah, I think for some of the brands and some of the clients I know that I've been talking to, that is pretty difficult with the shift patterns. And in the beginning, in the first 2 weeks, you might find people will stay to the same shifts. But as we move through the summer, people will want Friday off, or you know what it's like trying to manage shift patterns and everyone's requirements. But yeah, being mindful, I think, of that.
So you mentioned, and we've spoken about this on previous webinars as well, about the use of tech, for example, with the menus and so forth. I think that's something that most people will implement, but within the hospitality, to a certain extent, as you mentioned as well, we need to have that sort of relationship with the customers. So there will be some sort of contact with waiters just bringing out food, for example, if they're not taking orders, if they're not taking payment. there is some form of coming out and meeting the customers. What would you recommend we can do to be able to safely serve them? Because you can't really have a social distance between, you know, a waiter and a customer when you're serving their table, for example. So what would you recommend for that?
Yeah, there's a couple of different options that I know that people are looking at, rather than serving it at the table, than serving it at a location where you go and pick it up and bring it back to your own table. So there's that option. There's also the option if guests, and again, this is going to be it would be an education piece, if guests were able to wear a face covering at the table whilst the waiter puts down their food, and then they remove it after they've left. But, you know, and again, it's going to be very personal to your business. That is the process that's happening, I think, in Italy, as they reopen their hospitality businesses, Italy and France. You know, people wear the face coverings, you know, when they go to the toilet, for example, but they can take it off at the table. Yeah.
Yeah, I think that will, I mean, you can't eat with a face mask on at the end of the day. So something's got to give somewhere, doesn't it? So public transport is another one that we were talking about in school, because a lot of our children come in through trains and transport. And I'm guessing the same problem is going to be with employees of any business as well. So even, you know, hospitality being the big one, you know, especially with central London businesses, everybody's coming in on trains especially. And obviously that is associated with high risk at the same time. So what would you say to hospitality owners and operators about kind of protecting their staff and or providing any additional safety measures in that regard?
Yeah, I think again, it's educating your staff as to what the rules are. So checking in with them how they're travelling to and from work. Obviously, it's their responsibility to get to work, unless they're an employee that has a home base contract. Obviously, the new rules are that we have to wear face coverings legally now on public transport. So I think the government have sort of dealt with that really. And obviously coming into work, I think then it's useful to think about how you can provide a safe area where people can get changed and into their clean work uniforms. That's also important, to make it easy for them to take care of themselves. And, you know, obviously hand washing when they're coming in. You know, it could be that as they enter, they hand sanitize, and then access the wash hand basin before they take off their clothes and put their workwear on.
Yeah. I think, again, I think employers need to be well, empathetic, I guess, to employees' needs as well. So make sure they've given those spaces that otherwise there might not have been a staff room per se, but to actually give them that space to be able to do these things is really important. And again, the communication aspect, I don't know how many operators actually know how their employees get to work. So it's kind of making sure they've got that open line of communication going as well. Especially if you've got a large number of employees, as it, you know, as some businesses will have, it's going to be really, really important, isn't it?
Yeah, and I think this goes back to, you know, health and safety generally. We've always said it's a dialogue with your employees. You know, it's a bottom, as well as a top down, it's a bottom up approach. Really understanding and walking the floor and understanding from an employee perspective, you know, how's it going? What might harm you? What do you do to prevent harm to yourself? What do you do to prevent harm to others? What would you do if you saw X? What would you do if this happened? You know, really having that engagement with them so they feel confident to be able to deal with the challenges that come up.
Yeah, and on that, would you say that that's the operator's responsibility, the general manager's responsibility, or would you say that there's actually a growing need for, say, a health and safety person for operators to go to? What would you say would be the solution to this?
Well, every owner and every general manager will have their health and safety responsibilities. So it's definitely within their remit to make sure that health and safety is implemented and taken care of. I think the extra piece on top of it is perhaps the checking in with experts to make sure that you are doing what you say you're doing, and that you have some kind of external verification. You know, there's, as I was mentioning, there's the kind of government secure poster that, you know, you can put up, which is some level of verification. But there's also certification and accreditation schemes. You know, our experts offer, for example, a COVID safe audit, which they carry out, and then you get a certificate at the end to show that you've basically done all the procedures that you should have done, and that your premises is COVID secure. So there's that option that people can look at as well. But yeah, but not to be, you know, to be spending huge amounts of money on this. These are basic things that you can do yourself. But if you want the rubber stamp, I think that's a useful external validation to your customers that you are above and beyond.
This is it, isn't it? It's making sure that your consumers have that confidence with you, and just giving them that extra bit of reassurance. I've been saying this from day one, that people have been panicking about all of this, but as hospitality operators, health and safety is their #1 priority anyway. And, you know, this is what they're doing all the time. And yes, there is a couple of additional measures that we need to think about, but, you know, essentially you're doing the same thing as you've always done, with just a few more bits and bobs added. But I think the main thing in what I've been hearing from day one is about communication. So, you know, with what you're saying is kind of exaggerate what you're doing and make sure everybody knows about it, make sure you're talking to everybody about it, and that's really vital. But from a more interesting perspective, for me anyway, I've seen, 2019 saw a rise of the kind of the food hall kind of setup. You know, there's a huge one in Oxford Circus, for example, and they were popping out all over the place with different pop-up stalls and kind of that communal eating type of atmosphere. Do you think that's all gone now? Do you think that's dead, or do you think there could be something that we could do to kind of control traffic flows around those kind of areas? Or, you know, what would you say, what would your thoughts be on that? Is that going to be a dead industry, do you think?
No, again, I think it's just going to be one of those where it's the control of how many of capacity. So, you know, you think of somewhere like box parks, they're sort of, you know, that kind of springs to mind. And I think, you know, I guess this communal eating of coming in your bubbles as well. So people eating together is still going to happen. I mean, I think I was reading today in Big Hospitality about the amount of confidence there is in consumers to actually, as soon as those doors open, they're going to be straight back into hospitality. Something like 40% of consumers were just straight back in. It went higher if they were confident in the COVID-19 controls, kind of up to 60%. So I think that's the key, is being pragmatic, you know, showing people that you care enough about the fact that, you know, let's be clear, there is an outbreak. You know, this is an outbreak situation, and it is a virus, and viruses are, you know, invisible, basically. So we have to take these, you know, precautions of washing hands and keeping our distance and being, doing as much as we can in order to minimize the spread. But we can't eradicate the risk. We can't have zero risk in anything. So I think that's where the balance of those that will come out and enjoy being back in hospitality versus those where the risk is too high and they need to continue to isolate at home. And that's down to personal choice and your own situation. So
yeah, absolutely.
I'd hope we were back in those really nice market style eateries.
Yeah. So I could go on forever, but I think we have to wrap up here because we're getting short of time. So thank you so much. And I will pass on to Henel.
For me, there's too much to summarize in such a short period of time. And Natasha, you're absolutely right. To me, this is such a fascinating topic because there's so much, you know. For me, the way I see it, after healthcare, the hospitality is the next safest place in the world, because always cleaning. For me, when it was about washing your hands and things like that, I found it so funny, you know, all these videos, because I've always been washing my hands constantly in the kitchen, and it's like a second nature for us. And, you know, like, as you said, Angeline, like sanitizer spray and things like that. A year ago, I guarantee you, most people never probably heard the word sanitizer, or probably never even had a bottle in their household. But now, obviously, we've seen the demand of like huge prices, and that's a lot. Again, I could talk so much about this, but I think the trust needs to be given to the hospitality industry. You know, we've been doing it for years. It's not something we're learning. I mean, obviously, it's a new thing, Angeline, as you said, that we've got to be a bit more secure as a 6-star hygiene rating. But they need to trust us a little bit more, that we will pay attention to this. You know, we will make sure tables are clean. We will do what we can for our customers. At the end of the day, if the customers don't feel safe, they're not going to come in. If they don't come in, there's no revenue. So it applies to everybody, I think, for all industries. The happier you make your customers, the better they feel comfortable with you. Again, I'm going to stop talking and wrap up, but I've downloaded it. I promise you, what Angeline has provided, it's all in one place, rather than you spending your time searching which one's good. You know, there's so many places to find different templates for everything. I've gone through it and made sure I've looked at it, and honestly, it's valuable information. Please, everyone, get in touch with her. I want to say thank you to everybody that's been here, but before you go, we're going to put a poll up to see how well Angeline has done today. We appreciate you filling that in very quickly.
Can I fill it in myself?
No. I hope everybody has really gained some valuable information out of this, even taking a few points for any business you're in, really. But for yourself personally, it's so much to gain from this.
Then feel free to reach out.
I think we're nearly there. Are they displayed?
Yeah, I'm going to end the poll now. So, moment of truth, Angelina. Happy with that?
You're there.
I'll stop sharing now. Over to you, Henel.
Yes, if everybody doesn't mind, please unmuting yourselves and literally giving Angeline a big round of applause for this. And it's been really useful. Thank you again, Angeline, on behalf of everybody here. Guys, next week we're talking about technology, AV and things like that. Obviously, it's an important thing that needs to be done because, as Angeline said as well, mobile ordering technology's got to be now involved. We're going to have to look at how we can move forward with technology. So an important topic as well, like every single topic has been in our series. Next week, 6 o'clock, same time. Thank you everybody for coming. I think that's it from us, isn't it? Piyush, anything you think we can add?
No, all good.
Thank you everybody.